Something hospice nurses keep noticing in the final days that medicine still cannot explain. Strange reports, case file the visitors before death. Hospice workers have been reporting the same strange pattern for decades. In the final weeks of life, some patients begin describing visitors, parents, siblings, old friends, sometimes pets. The strange part is that many of these visitors are already dead. This is often called end-of-life visioning. Dr. Christopher Kerr, a palliative care physician in Buffalo, spent years studying these episodes. His work found that these visions are not usually random or chaotic. They are often comforting, and the people who appear are usually the ones who once protected, loved, or reassured the patient. Then there is the phenomenon nurses call the rally. A patient who has been silent, confused, or barely responsive may suddenly sit up. They speak clearly. They recognize family. They ask for food. Sometimes they seem for a brief moment completely themselves again. Then, often within days, they die. Medical literature has described this for centuries, but there is still no settled explanation for how it happens. And then there is the quieter pattern. In the final hours, some patients reach upward. Some smile at a point in the room no one else can see. Some speak to someone standing just beyond the bed. These reports appear across cultures, religions, and time periods. Believers describe them. Atheists describe them. Even patients who rejected any idea of an afterlife sometimes seem surprised by what they are seeing. Medicine often calls these hallucinations from a failing brain. But hospice workers tend to speak more carefully because they sit beside the dying. They see the difference between confusion and comfort, and many of them say these moments do not feel like ordinary delirium. Whatever is happening, it has been happening for a very long time. And the people who witness it most often seem to become the least certain about what it is. Report closed.